All right. Hello, everyone. Thank you for
Hi.
joining us today. Hi, Anas. Hi, Jennifer. Happy to have you here. We're part of the Xena Health Network community, and today we're talking about um, community-led healthcare solutions. So we're going to talk about why they're important and which ones are out there that we are going to highlight and that have a big impact on the health of their communities. So, my name is Athena. I am a pediatrician in Seattle, and I'm the founder of Xena. I created Xena so that we can bring people together from all sectors, including throughout healthcare and outside of healthcare, so we can create a new healthcare system that is aligned with our community's needs. So, our mission is to work together with our communities, listen to them, and have an adaptable and flexible healthcare system that's centered on the humans that we're caring for. So, would you like to introduce yourselves, Anas and Jennifer, and what you're
Jennifer first. Ladies first.
Thank you so much. Jennifer Taylor. I partner with healthcare organizations and healthcare leaders, as well as innovative companies around prevention and the future of healthcare. So, redesigning what the future looks like. And this is growth initiatives, strategy, all the different components, but really looking at proactive care models.
My name is Anas Abed Rabbo. I came from nursing background out of a practice. I am very interested on health technology. I used to have implemented a lot of the product and project in order to improve the quality and the healthcare system, apart from the change management. I am interested on empowering the patient and also the healthcare providers and try to find a new solution to improve our healthcare system. So, who I am?
great. Awesome. Thank y'all. Yeah. So, anybody in the audience, if you want to leave any comments or questions, we're happy to hear from you. So, I, I got interested in community led healthcare solutions because I have a background in global health. And I have seen firsthand when we push a one size healthcare system on communities without really partnering with them and understanding what it is that they need. So I've seen a lot of initiatives that are well intentioned, um, but really disconnected from the people that that initiative is impacting. And I've seen a lot of those programs have cause harm on those communities, as well as just miss the mark. And they may, help in some ways, but oftentimes they, when they're not really involving the community, they're not really having much of an impact on the health of that community. So I realized on coming back to the US that we're doing that here as well. We're not really listening to our communities and taking into account what it is that they need. There are some uh, some ways that our healthcare system tries to include the communities or bring them in some ways, but they're typically pretty minor, and oftentimes uh, they're not true partners in the design of the services that are being provided by the healthcare system. So that can uh, lead lead to the healthcare system really not meeting the needs of our communities. Um, so so that's how I'm really passionate about these initiatives that really bring in their communities as partners. Those are the ones that have true impact and that are sustainable um, because they're owned by the community. Um, and the community, when they are feel like they're leaders and they're driving, those healthcare solutions, they have more ownership and they can carry it on and feel empowered to lead those solutions. So I'd love to hear your thoughts on that, Anas and Jennifer.
Yeah, sure. Thank you for that. For me, also, I echo what you have said. I also fortunate to have a global experience in the healthcare system in different country, and I realized they have community where they sometimes maybe it's not intention to overlook what the patient they need or their family or companion, and most of the time they try to find the solution on their behalf with good and positive intention, for sure, because they have that. But sometimes they don't consider this patient maybe it's well educated, high profile, maybe can be an engineer or someone good in the business. They intend he is a patient or she is a patient, and they don't know what is the best for them, so they don't involve them and include them part from the caring plan and treatment plan. And this is something it's I witnessed it at first hand when I was on the ICU. I can understand sometimes when we have a critical case, we need to take action immediately without getting back to save the life. But it's not the case for all the time. So here where we started to normalize that we know better than you and we know the best of you. And sometimes we don't engage them from that. And that take us also to have this culture internally with us as a healthcare profession, where sometimes we don't involve the decision maker when we want to implement any new system or any new improvement. So sometimes we found one country they have implemented one project, they have a success story there. We thought what happened there it will fit in our community or in our culture without tailor it or without localize it, and that part from because we don't engage those people. Most of my experience implementing the project, I have more than 75 project implemented to implement a new healthcare solution. I never heard someone came from community or public or patient representative to be part from the community or stakeholder for this project. However, all those projects intended to improve patient outcome and treatment. So I feel, yeah, I think we need to pause on and start to think more with a new solution and try to find the different way and try sometimes to learn from other business, not necessarily healthcare, how they caring to get the customer or client feedback to improve their services. And I will not say patient as a customer, but we need to hear for them and really sincerely try to take their input to improve our system.
Yeah.
I agree with all of this. That's why we're in this discussion together. It's, two things come up for me is there's a trend around personalized medicine because I really think, one size doesn't fit all. And that's what we're trying to do. So in a community setting, we're like, oh, it happened over here with good results. We're just going to put that round peg, square hole, right, together over there. And it doesn't mean you're going to get the same result or even good results. So it's misguiding and a waste of time and resources. It also reminds me, like you were saying, about outside industry or looking at other things. The IKEA effect is known that when you are involved with something, even building something, you put higher value on it. You're more engaged. So whether you name it, just having a little bit of say into it helps with engagement and helps others to get involved in different ways. So for me, those are the two things that come up around this community. We can't just shove in anything to make it try to work. It's what does the community need? So it's being more personalized there. And then the other side of their involvement is going to help with engagement. And that's really what we want is in the healthcare system, we need more engagement.
Yeah, I absolutely agree. When we have this top-down model, and like you were saying, Anas, it's like a culture of where we are almost parents telling patients what to do.
Mm-hmm.
It really doesn't, it makes it hard for people to listen as well as be engaged in their care. So if as a provider you go into a clinic room with a patient and you say you need to lose weight and this is how you'll do it, we've shown time and again that this is not very effective, and people typically don't like that sort of top-down way of being spoken to and treated as if they have no agency. And so moving forward in healthcare, it's so important to shift that culture, to learn how to build relationships with the people we're caring for. So on that micro level, as well as on the larger scale with our communities, really truly listening and treating them as partners. When we listen for what is it that's important to them, what challenges do they face in their life, and then we can offer some guidance and support, and help them to navigate their way to health. And that creates a lot of agency for that person. They feel like, okay, I have a say in this plan, and I actually want to follow this plan. This is something that I co-created with my provider. So, yeah.
I have here, I think, if you allow me, a story or something happened with my friends. So he went for the family doctor, and just to give the background, family doctor here is very crowded and very rarely to find some one family assigned for you. So when you have a family doctor, you need to book appointment, and your appointment will be 10-minute max, and with this 10 minutes you will have one complaint. So imagine the pressure they have. So when my friend went for the family doctor, and immediately quickly with low profile of communication with the patient, what is your complaint, and he told him what his complaint, and they started to prescribe the medication for my friend. So he told him, you didn't do for me a physical examination, and I believe you need to do for me a blood test for this and that, and also x-ray. So immediately the doctor asked him, are you a doctor? Then he said, no, I'm not a doctor. I did this through the chat GPT. So here the doctor was not happy because he feel he is not having the control. And here the concept and the mindset, we need to change it. We need to involve them. We need to find the system to help the patient and build genuine and real communication. And one of things here, as a doctor, as a clinician, we need to understand those information was or knowledge. Now it become easy for anyone to go and check and validate. I'm not encouraging everyone to go for ChatGPT to do that, but now the access information has become easier than in the past. So it's good for us to make sure we change our mindset.
Yeah. Yeah, that's a great point. A lot of people are educating themselves, which is it's actually really great. I think, the way that our healthcare system has been built is that the physician is the expert, which they do have a lot. They are the expert in health in general, or the human body, but they aren't the expert in that person's life and that person's experiences, and what they are experiencing in their bodies. And so we need to have that partnership so that we can offer guidance with our expertise, and they can offer what it is that they're experiencing and their expertise in their body. And so just having that two-way communication and respect is so important. So yeah, I would love to hear about any models out there that you have read about or know some about that are community-led. We know that our current healthcare system is not centered on communities. doesn't really have any meaningful dialogue with the communities and with the patients. Oftentimes there are surveys that are sent out, but not a lot is done with them. And so what is out there that is actually allowing or opening the door for the communities to lead?
I have one example. I just wanted to kind of expand upon what you were just saying. There are organizations out there that even have community leaders as an extension, but a lot of times it's just putting money into things, and it's not really, like you were saying, more than just a survey or understanding. I think they're on their way towards something. I just don't know if their focus is to engage in the way that we're talking about, right? Maybe there's future strategies around it, but what we've seen so far, it hasn't been as dynamic or as robust as we would like to see as a community-led. An example of that in the Bay Area where I live is Roots Community Health Center. And this is based in East Oakland. So Oakland has its own challenges and different, environment for handling things. In 2008, it was founded to address inequalities, cultural response to whole person care. And that's part of their mission. With this, they do have a board, but the board engages small businesses, clinicians, nonprofit, community leaders, many different groups, as well as created a community alliance. And this is where that connection comes in, or that empowerment of the community voice, the community people that are either on the safety net providers or out in the community looking for service or struggling for service. So that community alliance is bridging that piece of it. And then they do have different programs around advocacy and member engagement that they do engage and meet to hear the voices and help with changing and impacting their residents in a better way. So that's one group that I'm just becoming familiar with, but I'm impressed with some of the services that they offer. It's definitely healthcare, behavioral health, and beyond. So they get into housing, they get into job searches, all the different components, because they're meeting the people in the area where they are, right? And understanding the different dynamics that they need to help them to thrive again with their health.
That's really awesome. Yeah, that's a new program to me as well. Yeah, so with the board that has members from the community, what is it that the community offers in that board? Do they advocate for things that they have heard that their community needs, or how does that work?
Yeah, there's forums for that. And then there's certain areas, whether it's advocacy, whether it's workforce, health navigation, and they talk through and help bring forward the concerns to get the support.
Yeah. And those addressing things like employment and housing, it's so important for the health of people. And it's overlooked in our healthcare system because, we feel like we need to just address the immediate problems and fix what's right in front of us. But once we get to the root of what might be causing health issues in people, such as chronic stress, lack of access to healthy foods, and mental health issues, if we address those root things, then we could see much healthier communities and not have to fix so many problems that are right in front of us. So with all of the programs I've researched, they've shown significant drops in ER visits, most of them around 50% or more drops in ER visits. So it's really impactful to address these things.
There's other metrics too that I've seen move the needle on missed appointments, right? So housing, let's say if they're transient and not able to find stable housing, it's hard to connect with them and to have the consistency, right, in the follow through. So that's another one of just managing their chronic diseases or whatever health issues they have at that time, right? That follow through and follow up. Having an address is important. And I learned that in my days of organ transplant and understanding what the barriers were. Housing could be one of them.
Yeah, absolutely. Yeah, so one of the programs that I'm really have been excited about for quite a while, that I've read a lot about, and it just drives me when I have learned about this, has driven me in part to start Xena, is the Alaska Native NUCA system of care. This is a system that was built by Alaska Natives 25 years ago when they took over their healthcare system. It used to be IHS, which is Indian Health Services, and they people weren't able to get into their primary care provider at that time, and the ER was overrun with people, and they had a significant mental health issues. But once they took over their healthcare system, they decided they wanted to do things completely different. And they saw their community as part owners in their healthcare system. So they call them customer owners. So I think you mentioned that, Anas, seeing them as customers, I think can really shift the dynamic, because then we're centering them and their experience. And so it's not just customer, but it's also owner. They're part owners in their healthcare system. So they have a big say in what services are provided and how they're provided. A big part of the NUCA system is building relationships with their community and truly listening. So they have sessions where they are listening to the stories of their community, and they're having feedback loops where they reflect back what they're hearing. And any of the system-wide changes that happen, they ensure that it's aligned with the culture of that community, and that the community is approving those system changes. A lot of people think, oh, that's too much, that's too hard. How do you even get anything done? But they've gotten so much done, and they've had a huge impact on the health of their communities. And not only that, they have 94% of patients say that they are really happy with their experience, and 97% of the employees are satisfied with their jobs, and they've had a significant drop in the turnover. I think it's like 57% drop in the employee turnover. And so it creates a really meaningful work experience where you feel like you are in alignment with your community. And I think that could really help our burnout issue. If we are doing work that is aligned with our communities and really meeting their needs, then that creates so much more meaning in the work that we're doing. So,
and I believe also, to be fair, there is from at least from my experience, I found some of hospitals, they try to implement community-led solution, but they implement a portion or small part from that, which is good to start with that. But I agree with you, NOCA system with the native Alaska, I feel they are more ecosystem. They implement it from up to down. So this is something is good. But some of the good experience, for example, here in Niagara Health, where I live, there is also, like what Jennifer mentioned, they sometimes they call for a board member from the community to come and to be part from the board member to help them to reflect the voice of the community and to be part from the decision-making process. How much this effective, to be honest, I don't know, but at least there is that things to do that. Also, navigating system, there is NGO organization, they try to help the patient as a navigator to take them sometime from the home to hospital and vice versa for who have low income or have disability, and also sometimes to help them to navigate and explore the treatment they have, because they have a specialized and well-educated team to work with that. So there is a lot of the initiative is good, but the issue here, I feel till now those initiatives is not integrated, and it's kind of silos between those. One of the things I really impressed one of the hospital they do, and this is came to me, maybe it's not directly related for community-led solution, but something they implemented when they have near miss cases or incident cases happening in the hospital. Sometimes they involve the family of the patient to be part from the investigation team, and try to make this as a more compliance and commitment for them to enhance and improve the internal process. So this is a huge, it is very sensitive topics, but at least some of the hospitals they take it beyond. I would like to see more a movement around that, and see more integrated between different team within the same hospital. And this is started from up to down to encourage that. And this is where, as a former healthcare provider, if I see my patient, if I treat my patient, I hear you, I listen for you, I will do what best for you, and we will take it this together because you are my partner. The burnout for me as a healthcare professional is will decrease, because they will support me, they will not give me attention. Less violence will happen, because they understand what I'm doing right now for them, even if I'm not do it in the right way. I did all my best. I am a human. So all those things related for burnout and anxiety, depression, fatigue, compassion fatigue, all of those, I will not say it's eliminated, but this is something will help us as working as a partner. And this is where we need to build the relation with our patient.
Absolutely. So well said, Anas. Yeah, when a lot of the root of burnout is a feeling of powerlessness. Like you want to provide quality healthcare, but the system is getting in the way, as well as a feeling of isolation, not getting to really connect with your patients and with your community. So when we have these sort of initiatives where we're actually partnering with our patients, then it mitigates a lot of those root issues. And instead of trying to deal with the symptoms of burnout, we're actually getting to the root of it.
I wanted to go back to something that Anas said about ChatGPT and things like that, and just challenging MDs in a way with knowledge. I do believe that when we're looking to one person for all the answers, it's hard, right? And in a 15-minute window. So understanding that we need to expand our options beyond medication and provide maybe a more comprehensive viewpoint. I think when you get into community and these discussions, it becomes even more prevalent to you. You know what I mean? Like it definitely will help you to understand that the menu needs to be expanded instead of just one size fits all.
Yeah, absolutely. I love that, the menu expanding. I think when people are empowered with knowledge, they have more choice. And it's important to be able to feel like you are able to choose where you want to go, and you don't have to rely on somebody who has all the knowledge to tell you where to go. So
one thing here also, maybe for the same topic about ChatGPT, but how we can utilize the technology to build the trust and to engage the patient and be part from the treatment. I did implementation for a project back on days before ChatGPT's, maybe 10 years ago, where one of the hospitals, they have a request to have a patient mobile app. So a patient, when they are visiting their physician or ER visit, whatever the type of the visit, so based on the diagnosis has been diagnosed for the patient, they will find what kind of questions you need to ask your provider. So the app will suggest for you, you need to ask this 1, 2, 3, 4 for the patient. So as a patient, I will be educated those things I need to be cared for that and make sure I understand my diagnosis. So it was something in the beginning, and we take it up to implement it. But this is one I got initiative in that time where we try to implement the technology and make sure in that time we engage the patient, increase data satisfaction, and partnering with the patient. And at the same time, because it is more private sectors there where they need more about patient satisfaction to be increased. So this is a lot of the things we can utilize it with with the technology. Right now, it's a free resource. Anyone can go for ChatGPT and find it.
Mhm. Yeah. Yeah, that's awesome.
I like the idea of, when we're thinking of community led, we're also educating them with that engagement, depending on what's coming up. So things like, the ChatGPT questions, right? How to be more insightful and inspire a deeper conversation with your provider. So I like that it is still a two-way listening street, right? And maybe we can help insert earlier some of that dialogue when you're engaging the community.
Yeah. Yeah, and I feel like technology is advancing, and AI is absolutely a big part of our healthcare system now, and it's going to become even more. And so we have to think about how we can use it in smart ways to really support the health of people and empower them so that they have the education that they need, as well as, helping providers so that they can have more time to connect with their patients and more opportunity for that. So seeing it as an ally and using it in that way, I think, is so important. Another initiative that I have read about that excites me a lot is the Prevention Institute. It is based in California, and they partner with local coalitions to design upstream cross-sector solutions that are based on the community identified issues. So the community may raise some sort of issue. And an example was, I don't remember exactly where it was, but there was a intersection where a lot of traffic accidents were happening and many people were getting hurt. And so the community raised that as a health issue, and the Prevention Institute got a lot of different sectors together, public health, community members. They got, I'm not sure what the traffic department was, but they had all of these different sectors together to create a solution together with the community voices at the forefront. Because they recognize that when you try to design a solution without the community involved, it often misses the mark. And then you spent all of this money and all of this time on a solution, and you're still having a lot of traffic accidents. And so they had a really innovative solution that they created that really supported the people in the community to stay safe and to I don't remember the statistics around how many lives were saved and how fewer accidents there were, but it was it was pretty remarkable. So that's just an example of an initiative that the Prevention Institute did. So I think having those coalitions across sectors with the community voice in the center is pretty profound and impactful.
I agree. And I think that when we step back and think about the model of prevention strategies and the primary, the secondary, and the tertiary levels, I think we're dealing with trying to get out to that primary prevention, right? Which would be traffic accidents, any kind of SDOHs, anything like that. And I think that's what we're talking about is community-led at that level, right? Which helps with the proactive care and proactive relationships in the community.
Yeah. Yeah, proactive care instead of reactive.
Yes.
Mm-hmm. Yeah. Okay. Well, we are at the end of our session here. If you want to have any last remarks on community-led solutions, you can hop in. And if anyone has out there wants to comment or ask any questions, just let us know.
I think I just want to end with, going back to the IKEA effect. When you engage people, they're bought in they value it differently. And now you can bring them in to the solution, and it makes a more comprehensive and targeted. You're actually meeting the mark instead of just guessing.
Exactly. Yeah. Beautifully said. Thank you, Jennifer. Anas, any last remarks?
Actually, also I see it from my perspective because I do remember my time when I was on the ICU. I think to implement a solution, community-led solution, also we need to consider to empower our healthcare providers. So all healthcare providers need to be empowered to take immediate on-spot action. So one of the things I wrote about it one time on LinkedIn, if maybe it's good if we can learn from hospitality industry like Ritz-Carlton, where they have policy, everyone have a budget about 2,000 to response for any customer needs within 2,000 without getting an approval. So the same concept, if we have a role and responsibility clear, and not for sake of the money, for sake of you are have the authority sometime to jump in and help your patient, and for sure we take care for the patient life and all those things based on evidence based. But we feel, and I don't know, I think if you agree with me, I feel the healthcare profession till now, whatever their background or title, still we have ranking and we don't have that power. Sometimes even to communicate with the patient. That doesn't mean we don't need training and education and all those stuff to make sure when we are empowered, we have the right tool and skill set to communicate with the patient. So it, it is a lot of the things we need to work together to make it. So this is where I can see it from my perspective. If I came to work in the hospital, I will ask to have more empowerment when I communicate with my patient.
Yeah, that's a great point, to have that adaptability and agency so that you can impact your patients. Yeah, absolutely. Yeah, so I think when we have these community-led solutions, it naturally helps with our health equity issues, and we naturally shift towards an equitable system because we are listening to the community and addressing their needs. And it's not just a faction of the community, it's everyone, and different pockets of the community, really listening to what they need and addressing those. So having this adaptable healthcare system and giving the providers the agency to practice at the top of their training, as well as I think it's so important in our healthcare system to train providers to have that emotional intelligence and the ability to connect with their patients and relate to them. Those are really important elements in having a community-led healthcare system. So, yeah, thank you all for joining. This has been a wonderful discussion, and I look forward to more. So if anybody is interested, Xena Health Network is a community to come in and have an impact as we're building a healthcare system that is community-centered and human-centered. So come in and join us. You can join for free, listen to the conversations that we're having, and start getting involved. So, all right. Thank you, Anas. Thank you, Jennifer.
Thank you so much.
Thank you. Bye bye. Have a good day.
Bye-bye. Have a great day.